I'm going to talk a little bit about the section on medical schools because I think that sometimes the way the AMA works and the way some of the sections work and how policy is made is not always well understood. The section on medical school, the SMS, is particularly positioned to address key medical education and practice issues. It's one of the few professional, if not the only professional organization we can belong to where their individual memberships, that the individual has the opportunity to have significant input into policy. And as individual members, we can propose policy that goes through the sections, such as the section on medical school or other special groups. It can go through state medical societies. It can go through our specialty societies. And then those resolutions, those proposed resolutions that are discussed in our individual groups, go forward to reference committees. And there is a specific reference committee on medical education, Reference Committee C, goes to hearings, and then recommendations from those reference committees go to the House of Delegates for vote, and those that are voted in as policy then go on for policy implementation. And just to give you an example of how this does indeed work, several years ago now, we had a group of medical students at our institution who thought that service learning should be a standard, and the AMA is one of the two parent organizations for the Liaison Committee on Medical Education. They worked with our state medical society to put forward a resolution. It was also considered and sent forward and recommended by the section on medical schools. Went all the way forward for policy implementation, and the AMA sent that forward to the LCME, and it ultimately became one of our LCME standards. One of the things that we've looked at from the Governing Council, again, are opportunities for academic physicians to become engaged. And one of the things we've looked at is the membership structure. And there is a new proposal for a membership structure that takes some of the financial barrier away from participation. But basically what it offers is a discount for group memberships, and particularly trying to encourage the key leadership of the academic medical center in participating. The AMA also does a lot of advocacy that's important to our institutions and to medical education. They advocate for adequate and stable federal funding for medical education and research. We had a joint meeting of the Governing Council of the Section on Medical Schools this week with the Administrative Board for the Council of Deans, and one of the topics was the advocacy for GME funding, which we know is a critically important issue in order to increase the number of physicians, because if we don't have GME slots, it's very difficult to increase the number of practicing physicians. And this is an area where the AMA and the AAMC are very actively involved in advocacy. The AMA is also an advocate for ensuring access to care and equitable physician reimbursement, which is important to our faculty practices and not just to physicians in private practice. The AMA sponsors programs to promote public health and ensure safety, and they work actively on the learning environment for students and residents. And the learning environment is one of the very high priorities, along with holistic admissions, that the AMA has been working on that affects medical education.